Welcome to the Clinical Pen.
Glad to be here.
So today we're going to talk about something, well, frankly baffling when you look closely. A disease that's just incredibly contagious, like one of the most infectious ones we know.
Right. Extremely easy to catch.
And yet, the truly mind-bending part is we've had a fantastic vaccine for it for, what, over 60 years now? It should be gone. 0 cases.
A medical triumph, really.
But, and this is the frustrating part, it still causes tens of thousands of deaths every year, mostly young children. It just doesn't quite add up, does it?
It really highlights a gap, doesn't it, between having the scientific tool and actually implementing it effectively everywhere. The human element, the logistics, it's complicated.
Exactly. So let's discuss the essentials today, what you really need to know about this illness, focusing on the most important, maybe even surprising details.
Sounds good.
And before we dive in, just a reminder, make sure you subscribe to the Clinical Pen so you catch all our discussions. And you can always find more info at clinicalpen.com.
Definitely check it out.
Okay, so let's get started. What is this disease we're talking about? What is measles?
Okay, so measles is an acute viral respiratory illness. It's caused by a specific virus, a morbillivirus. Basically, it primarily attacks your breathing system.
And when it attacks, what are the classic signs, the things people notice?
Well, typically you see a really high fever, first off. Then there's usually a bad cough, conjunctivitis, red, watery eyes. And then that very distinctive rash people associate with measles.
Right, the rash.
And while we often think of it as a childhood disease, it definitely affects adults too. And it can actually be quite serious for them as well.
You said incredibly contagious earlier. Just how contagious are we talking?
We're talking extremely contagious. The numbers are stark. If one person has it, up to 90% of the non-immune people around them are likely to get infected.
90%. Wow. That's almost inevitable if you're not protected and you're nearby.
It really is a remarkably high transmission rate.
So, thinking back, before we had the vaccine in 1963, what did that look like? What was the impact?
Oh, it was devastating. Before the vaccine, measles was just a fact of life, but a deadly one. Huge epidemics would sweep through populations every, say, 2 to 3 years.
Yeah, the death toll.
Estimates are around 2.6 million deaths globally, every single.
2.6 million a year. Just staggering. It puts the vaccine's impact into perspective.
Absolutely. It fundamentally changed childhood survival rates.
So how does a virus this good at spreading actually, get around? How does it move from person A to person B?
The main route is respiratory droplets. When someone with measles coughs or sneezes, or honestly even just talks.
They spray tiny virus particles into the air.
Exactly. Little invisible droplets loaded with the virus.
And those droplets just vanish? Or do they stick around?
That's a key part of why it spreads so well. The measles virus can actually stay alive and infectious in the air, or even on surfaces, for up to 2 hours after the sick person has left.
2 hours. So you could walk into a room long after someone infectious was there and still potentially breathe it in.
Precisely. You don't need direct contact. Just sharing the same airspace within that 2-hour window can be enough if you're not immune.
Okay, that's quite persistent. So it's in the air, it hangs around. How does it actually get into your body?
It usually enters through the mucous membranes, the lining of your nose, your mouth, or your eyes. Once it's in, it starts replicating right there in the respiratory tract. Then it spreads systemically.
Throughout the whole body. Now, the contagious period. Is it only when someone has that obvious rash? Or is there more to it?
This is crucial for understanding its spread. You're actually contagious for about 4 days before the rash even shows up.
Before. So you feel maybe a bit unwell, but look fine, and you're already spreading it.
Exactly. You might just think you have a cold or the flu, and then you remain contagious for about 4 days after the rash appears too.
That before period seems really problematic for control.
It absolutely is. People are out and about, interacting normally, completely unaware they're spreading measles. It's how outbreaks can take off so quickly, especially in communities with lower vaccination rates.
Right. So let's say you've been exposed. How long does it typically take for symptoms to start? What's the incubation period?
Usually, symptoms start appearing about 7 to 14 days after you're first exposed to the virus.
And what comes first? Is it the rash?
No, typically not the rash first. The initial phase often feels like a really nasty cold or flu. You get that high fever we mentioned.
No, potentially very high, like over 104 Fahrenheit, 40 Celsius.
Yes, it can definitely spike that high. And along with the fever comes that hacking cough, a runny nose, and the conjunctivitis, those red, watery, uncomfortable eyes.
Okay, so fever, cough, runny nose, red eyes. Then what?
Then, maybe a couple of days into those symptoms, something quite specific might appear. Complex spots.
Complex spots, what are those?
They're tiny little white spots, almost like grains of salt, that can show up on the inside lining of the mouth, often on the cheeks. They're a pretty strong indicator of measles.
Huh. Inside the mouth. Interesting. And then comes the famous rash.
Yes, usually about 3 to 5 days after the first symptoms start, and maybe a day or two after any complex spots, the main rash appears.
And what does it look like? How does it progress?
It's typically a red, kind of blotchy-looking rash. It classically starts on the face, often around the hairline and maybe the upper neck. Then over the next few days, it spreads downwards.
Down the body.
Yeah, down the trunk, arms, legs, like a wave moving down the body.
How long does this rash phase last?
It usually sticks around for about 5 to 6 days.
Mm-hmm.
Then it starts to fade, generally in the same order it appeared, starting from the face and working its way down.
Does the fever finally break when the rash comes out? Or does that linger too?
Unfortunately, the fever can often continue for several days, even after the rash is fully out. It doesn't necessarily resolve right when the rash appears.
So it's really a whole body systemic illness, high fever, respiratory stuff, eye irritation, mouth spots, then the widespread rash. Definitely not just skin deep.
Not at all. It's a significant illness.
You know, sometimes you hear people, maybe older generations, talking about measles like it was just a normal childhood thing, maybe even mild. Is that accurate?
That perception is, well, it's really dangerous, actually. It's just not accurate. While some people might get a milder case, measles can cause incredibly serious complications.
Right. Serious how? Can it lead to long-term problems or worse?
Absolutely. It can lead to permanent disability, and it can definitely be fatal.
And are certain people more likely to have these bad outcomes? Who's most at risk?
Yes, there are clear high-risk groups. Very young children, especially infants under 5 years old, are particularly vulnerable. Also, adults over 20 tend to get more severe disease. Pregnant women are at higher risk too. And of course, anyone with a compromised immune system, for whatever reason.
Okay, so what kind of complications are we talking about? What are the more common ones?
Well, ear infections are pretty common, affecting about 1 in every 10 children who get measles. They can sometimes lead to hearing loss.
1 in 10. Okay.
What else? Diarrhea is also quite frequent, seen in maybe 8% of cases. And that's concerning because severe diarrhea, especially in young kids, can quickly lead to dangerous dehydration.
Mm-hmm. Dehydration is always a worry with little ones. Is there one complication that stands out as the most dangerous, the biggest killer?
Yes. Pneumonia. That's the single most common cause of death from measles.
Pneumonia. So the measles virus weakens the lungs, making way for a secondary infection.
Precisely. It damages the respiratory system's defenses, making it much easier for bacterial pneumonia to take hold, and that can be fatal, especially in those high-risk
A
groups.
stark reminder, it's not just a rash. Are there other, maybe less common, but really severe complications?
Yes, unfortunately. One is encephalitis, which is swelling of the brain.
Brain swelling. That sounds incredibly serious.
It is. It occurs in maybe 1 out of every 1,000 cases,
Wow.
but it can cause seizures, deafness, intellectual disability, permanent brain damage.
Wow.
And then there's something even rarer, but truly devastating, called SSPE, subacute sclerosing panencephalitis.
SSPE. I haven't heard of that. What is it?
It's a progressive, fatal neurological disorder. And the terrifying thing about SSPE is that it doesn't happen during the measles infection itself. It develops years later,
Yes. How many years?
often 7 to 10 years after the person initially had measles, usually as a child. The virus essentially stays dormant in the brain and then reactivates, causing slow but relentless destruction of the central nervous system. There's no cure. It's always fatal.
That's horrifying. A consequence showing up a decade later from a childhood illness.
Exactly. It really underscores why preventing the initial infection is so utterly critical. There can also be blindness resulting from corneal scarring caused by the infection or complications.
Given how serious this can be, how do doctors figure out if someone has measles? How is it diagnosed?
Well, in areas where measles is still common, doctors often make a clinical diagnosis based on that classic combination of symptoms we discussed. The high fever, cough, conjunctivitis, the specific rash pattern, maybe those complex spots if they see them.
So based on seeing the signs.
Right. But especially in places where measles isn't common, or during an outbreak investigation, lab confirmation is really important.
And how do they confirm it in the lab?
They can do blood tests to look for specific measles antibodies called IgM antibodies, which indicate a recent infection. Or they can use more direct methods like RT-PCR on samples, like a throat swab or urine, to actually detect the measles virus's genetic material.
Okay. So if someone even suspects they or their child might have measles, what should they do?
The absolute first step is to seek medical attention immediately. But it's also really important to call ahead to the doctor's office or clinic
Call ahead. Why?
to let them know you suspect measles before you arrive. This allows them to take precautions to prevent spreading the virus to others in the waiting room. Remember how contagious it is and how it hangs in the air?
Ah, right. Good point. Prevents exposing vulnerable people.
Exactly. And getting that medical evaluation is crucial for managing the illness, watching for those complications we talked about, and also for public health reporting, so they can track and control potential outbreaks.
Okay, so once it's diagnosed, what's the treatment? Is there a magic bullet antiviral drug?
That's a really key point. Currently, there is no specific antiviral treatment for measles. We don't have a drug that directly attacks and kills the measles virus once you're infected.
None at all. So what can doctors do?
Treatment is all about supportive care. Basically, helping the body fight the infection and managing the symptoms to prevent complications.
So things like,
Making sure the patient gets plenty of rest, stays well hydrated, which is super important with the fever and potential diarrhea. Using fever reducers like acetaminophen or ibuprofen to manage the high temperature. Sometimes things like cough medicine or using a humidifier can help with the respiratory symptoms.
and what of those bacterial complications like the pneumonia or ear infections you mentioned?
Right, that's where antibiotics come in. Antibiotics don't work against the measles virus itself, of course, because it's a virus. But they are essential for treating those secondary bacterial infections that often pop up because measles weakens the immune system.
Okay, so antibiotics for complications, supportive care for the main illness. Is there anything else? I think I read something about vitamin A.
Yes, absolutely. Vitamin A supplementation is actually a really important part of treatment, especially for children in areas where vitamin A deficiency might be common, but it's recommended generally.
How does vitamin A help?
Studies have shown that giving vitamin A can reduce the severity of measles symptoms, shorten the duration of the illness, and significantly lower the risk of dying from measles or its complications.
That sounds pretty significant. Is there a standard recommendation?
Yes, the World Health Organization, the WHO, recommends that all children diagnosed with measles receive 2 doses of vitamin A given 24 hours apart.
Interesting. So supportive care plus vitamin A. But the lack of a direct cure really highlights how important prevention must be.
Absolutely paramount. Since we can't easily cure it, stopping it before it starts is everything.
And we do have a way to stop it, right? The vaccine.
Yes. The single most effective way to prevent measles is vaccination. We have the MMR vaccine, which protects against measles, mumps, and rubella all in one shot.
And how good is it? Is it effective? Safe?
It's incredibly effective and has a very strong safety record, backed by decades of use and study.
How effective are we talking?
The standard recommendation is for 2 doses. Just 1 dose gives you about 93% protection. But getting the second dose bumps that protection up to around 97%.
97%. That's fantastic against something so contagious. When do kids typically get these doses?
The timing can vary slightly by country, but generally the first dose is given between 9 and 12 months of age. The second dose usually comes later, often between 15 and 18 months, or sometimes around the time a child starts school, like age 4 to 6.
2 doses for near total protection.
Right. 2 doses are key for robust, long-lasting immunity.
We hear the term herd immunity a lot with vaccines. How does that work with measles?
Herd immunity is crucial for measles because it's so infectious. When a very high percentage of a population is vaccinated, and therefore immune peak, the virus finds it really hard to spread. There just aren't enough susceptible people for it to jump between.
So it protects more than just the person who got the shot.
Exactly. It creates a protective bubble around those who can't be vaccinated. Think about tiny babies too young for the first dose, or people with severely weakened immune systems, or pregnant women who generally shouldn't get the MMR vaccine. High vaccination rates protect them indirectly.
What kind of vaccination rate do we need for that protection?
Because measles is so contagious, you need really high coverage. The target is generally around 95% of the population having immunity, ideally through 2 doses of the vaccine, to reliably prevent outbreaks.
95%. That's a high bar to clear consistently across the globe.
It is, and that's part of the challenge.
Right, because despite this amazing 97% effective vaccine, you mentioned earlier that measles still caused, over 140,000 deaths globally in 2018, mostly kids.
Yes, the numbers are still tragically high, even though they're vastly lower than pre-vaccine levels.
So why, if we have the tool, why does it keep happening? What are the main roadblocks?
It's really a combination of factors. Unfortunately, one significant issue, especially in some higher income countries recently, has been vaccine misinformation and the resulting vaccine hesitancy.
People choosing not to vaccinate based on false information.
Correct. And that erodes herd immunity, creating vulnerable pockets where the virus can ignite an outbreak if introduced.
Okay, what else?
In many lower income countries, the challenges are more about logistics and infrastructure. Just physically getting vaccines delivered consistently, keeping them cold, the cold chain, and reaching every child, especially in remote areas or conflict zones, is incredibly difficult.
So weak healthcare systems, instability.
Yes, conflict and humanitarian crises are major disruptors of routine immunization programs. Millions of children miss out on vaccines during emergencies. And sometimes, even where systems are okay, public health campaigns might not be strong enough or might not effectively counter local concerns or misinformation.
It's a complex web of issues.
It really is. No single cause, but a mix of social, economic, and logistical barriers.
And this leads to situations where even countries that had eliminated measles, like the U.S. did back in 2000, are seeing it return.
Precisely. Elimination means stopping continuous transmission within a country for over a year. But it doesn't mean the virus is gone globally. So if someone travels from a country where measles is circulating, gets infected, and comes back to a community where vaccination rates have slipped below that 95% threshold.
An outbreak can start.
Exactly. Imported cases spark local transmission among unvaccinated people. It shows that elimination requires constant vigilance and maintaining high immunity levels.
Which really underscores the importance of global public health efforts, doesn't it? What kinds of things are being done on that front?
There's a huge amount of work led by organizations like the World Health Organization, WHO, UNICEF, Gavi, the Vaccine Alliance, and national health ministries. They work on strengthening routine immunization systems, running large-scale supplementary vaccination campaigns, sometimes targeting millions of children in a short period.
Like school-based drives or national vaccine days.
Yes, exactly.
Yeah.
Plus, public awareness campaigns to educate parents and communities about vaccine safety and importance, and crucially, robust surveillance systems.
Surveillance to track the disease.
Right. To quickly detect measles cases and outbreaks when they occur, so health officials can respond rapidly to contain the spread.
It's a massive ongoing effort. So for individuals listening, especially if they travel, what's the key advice?
Be aware that measles is still common in many parts of the world. We're talking regions in Europe, Asia, the Pacific, Africa. So if you're planning international travel, the number one thing is to make sure you are fully vaccinated against measles.
Fully vaccinated means 2 doses of MMR.
Typically, yes. Check your records. If you're unsure, talk to your doctor. Ideally, you want to be fully vaccinated at least 2 weeks before you travel to give the vaccine time to work effectively.
What about babies? Infants too young for the routine schedule.
Good question. For infants aged 6 months through 11 months who are traveling internationally, the recommendation is actually to get 1 dose of MMR vaccine before they travel.
An early dose just for travel.
Yes. It provides some important protection during travel. However, it's crucial to remember that this early dose doesn't count as part of their routine series. They still need to get the standard 2 doses later, starting at 12 months or according to their local schedule.
Got it. Important distinction. It really drives home how global health is local health these days.
Absolutely. Viruses don't respect borders.
We touched on misinformation being a challenge. Let's tackle some of those myths head on because they really do cause harm.
Yes, it's so important to counter these. False claims can have deadly consequences when people avoid life-saving vaccines.
Okay, myth number 1. Measles is just a mild, harmless childhood illness.
Fact. Absolutely not harmless. As we've discussed, measles can cause severe complications like pneumonia, encephalitis, lifelong disability, and death. Dismissing it as mild is dangerous.
Myth number 2. Getting the disease naturally gives you better, stronger immunity than the vaccine.
Fact. While it's true natural infection usually leads to lifelong immunity, it comes at a huge potential cost, the risk of all those severe complications, including the possibility of SSPE years down the line. The vaccine gives you robust protection without forcing you to gamble with the dangerous risks of the actual disease. It's immunity achieved safely.
Right. Safe immunity versus risky immunity.
Precisely.
And the big one, the myth that just won't seem to die. the MMR vaccine causes autism.
Fact. This has been exhaustively studied and thoroughly debunked. Numerous large-scale, high-quality scientific studies involving millions of children worldwide over more than 2 decades have consistently shown there is no link between the MMR vaccine and autism.
No link whatsoever.
No. None. The original study that suggested a link was retracted years ago due to serious flaws and ethical breaches. Promoting this myth continues to frighten parents and puts children's lives at risk from preventable diseases like measles.
So trust the overwhelming scientific consensus. Trust the public health bodies.
Absolutely. Rely on credible sources for health information.
Okay, so let's try to wrap this up, pulling it all together.
Measles. It's highly contagious. It can be very serious, even deadly, causing significant complications.
But, and this is the crucial, but it's almost entirely preventable. We have a safe, highly effective vaccine, the MMR.
Right. And despite the vaccine drastically reducing the global burden, the disease persists. It persists because of gaps in vaccination coverage.
Gaps caused by a mix of things. Misinformation, logistical challenges in delivering vaccines everywhere, disruptions from conflict or crises.
Which means we need ongoing vigilance, strong public health efforts, continuous education, and a commitment to getting vaccines to everyone, everywhere. Vaccination isn't just personal protection, it's community protection through herd immunity.
It really is the cornerstone.
You know, when you step back, considering we have the science, we have the tool of vaccine that works incredibly well, the fact that measles still causes so much suffering forces us to ask bigger questions, doesn't it?
Like what?
Like, what does this ongoing struggle tell us about the non-scientific challenges, about global inequity in healthcare access, about building trust between communities and health systems, about how we combat dangerous misinformation in a connected world? It's more than just virology.
That's a really powerful thought to leave people with. It's about the whole system.
It is.
So the takeaway for everyone listening, understand how measles spreads, recognize the science, and critically value and utilize vaccines. It's about protecting yourself, your family, and really everyone around you.
Stay informed, get vaccinated, stay safe.
And please don't forget to subscribe to The Clinical Pen wherever you get your audio. To check out clinicalpen.com for more resources. Share this discussion if you found it helpful. And we always appreciate hearing from you. So please leave us a comment with your thoughts or questions. Thanks for joining us.
Thank you.